without further ado, we'll get started with a Q&A with Dr. A.
Welcome, everyone. I'm glad you're able to join us today.
Wonderful. Well, thank you so much. So the first question I had, and I love hearing when you talk about this, you had a whole other career before public health. Just tell us about that. What did you do and how did you get involved in public health?
All right, so that is correct. I started my professional career as a sociology professor. So I did the traditional graduate school route. I went straight into graduate school after my undergraduate and earned a doctorate in sociology and did a postdoctoral research fellowship, which is kind of uncommon for sociologists, but I did a research fellowship on HIV out at UCLA. And that was my first inkling, maybe this is where I need to be. And so anyhow, I joined a department of medical sociology, which is a little bit unique here at UAB because of the strong medical school tradition of the whole university. The sociology department is focused specifically on medical sociology. So, okay, I'm going to be able to study health, I'm going to be able to really focus on how to address health disparities, which is my key research interest. And so I became a professor and I started teaching my courses and I started looking for opportunities to get involved and had lots of great opportunities. You know, here at UAB, we have one of the most advanced centers for AIDS research and associated clinic, the 1917 clinic that serves people living with HIV throughout the Southeast. So I was really excited about those opportunities. And yet the feedback I kept getting from colleagues was, no, sit quietly in your office, think about things, write research articles that no one will ever read. I was like, well, that doesn't sound like a very exciting life. And that's definitely not what I thought I was getting into. So I realized pretty early on that being a sociology professor, at least in that particular department, was just not going to be the right fit for me. And at that time, I'd started to get to know lots of people in the School of Public Health here at UAB and, started developing some research collaborations and doing more of the kind of work that I wanted to do. And I eventually left UAB because I knew that wasn't going to be a good long-term position for me. And I went to the Department of Veterans Affairs Hospital here in Birmingham and worked as a project coordinator for several studies of homelessness among veterans, which is another one of my big research areas. And so I did that for a couple of years and continued to collaborate with people at UAB, particularly in the Division of Infectious Diseases and working on STDs and HIV, because again, that's kind of my big research area. And at that same time, I decided, you know what? Public health is where I always probably should have been. This is my opportunity. I'm going to actually get an MPH. So as a grown working adult, I made the choice to go back to school, as I imagine many of you are doing, and pursue my MPH. And I did that online so that I could continue working. I didn't go to UAB, and we can talk a little bit later about why that was, but I did that. And at that same time, the undergraduate program here in the School of Public Health at UAB was really growing, but they didn't have faculty who had experience teaching undergraduates. And so I kind of showed up and was like, hey, I have an MPH now, and I have, 10 years of experience teaching undergraduates, and can I have a job? And they were like, yeah, that sounds right. And so then I came back to the School of Public Health in the Department of Biostatistics because my primary teaching is all in statistics and research methods. And this has been absolutely the scariest thing I ever did, changing careers halfway through, but then also the best thing I did because I ended up here in the School of Public Health. And I'm, every single day, I am thankful that this is where I am because this is definitely where I was meant to be. So.
Thank you. I always love when you describe how you got to your career now. So you got your MPH and you review applications. So since we have a lot of prospective students in the audience today, just talk briefly about what you look for in the application process.
Right. So One of the things for me that is really critical in the application process is the personal statement. Students come to public health from all different disciplines. It's actually, only a small handful of our students come to graduate studies in public health having a public health educational background, because now there's lots of schools that offer undergraduate public health degrees, but that wasn't the case until, probably 8 or 10 years ago. And so most people don't have that training. So I don't look to see, oh, do you have a public health, education background? That's not what I'm looking for. What I'm looking for is people who are really clearly going to be committed to doing the work of public health and who understand what it means to serve their communities. And honestly, what I'm looking to see is that people have thought carefully about that. So the vast majority of, personal statements that we read say, I love people, I want to help. And and that's great. I love people too. And I'm glad you want to help, but I'm always looking for, okay, and what does that mean for you? How are you going to take your background, your unique talents and skills, and get a degree in public health that shows you how to focus and really make an impact in your community? So what I look for when I'm reading applications is that you've thought, I think I would like to work at a state health department because I think it's really important that health be supported at the governmental level and that all of the essential functions of state health departments get upheld. Or, I really care about food insecurity as an issue. And so my goal would be to work at a nonprofit that is addressing issues of hunger in my community. So taking it to that next level. This isn't locking you in. This isn't saying this is the only possible career trajectory. We're not going to go back and check at what you said you wanted to do after you got your degree. But really just having a sense of what your particular role in public health might look like. That helps us to know, okay, this person knows a bit about the field of public health practice, and they know what it might be like to work in that field. Now, a lot of people who come to our different degree programs are already working in the field of public health. And so they're able to say, this is what I'm currently doing. These are the skills that I want to gain so that I can move up and I can be doing this. Because, the master in public health in particular, because it is designed to be a terminal degree, that means that can be the highest degree that you earn. It is designed to prepare people for leadership in public health. And so for a lot of people, getting an additional degree, getting the MPH degree, is how they're going to move up and become a leader in the field of public health. So those are the sorts of things that I'm looking for. Something a little more concrete than I just want to do good stuff. I mean, that's, that should be in there somewhere too, because hopefully that's one of your goals. But really, painting a picture of what that looks like for you and how your unique skills, if you say, one of the things that I am fantastic at is communicating with different types of people. I'm able to read people well. I'm able to figure out the concerns that people have, and I want to be able to use that skill in public health. Yeah.
Thank you. And so we have a lot of online students, particularly given, everything that's been going on.
Mostly.
So right. that old thing. So tell us about just, some tips that you have for pursuing an online MPH in particular.
Yeah. So like I said, I was working full time at the VA hospital while I was doing an online degree. And I'm of an age that we didn't really have online courses when I was in college or graduate school. So it was a really new modality for me. Funnily, I had taught an online course before, but I hadn't ever experienced it as a student. And so I didn't know, is this going to work for me and for the ways that I learn? And so I started out by applying to a certificate program. And my plan was just to kind of feel it out and see if I thought I was going to be successful in online courses. So I started with a certificate, and I immediately realized, oh yeah, this is going to work great for me. And the reason for that is because I am by nature very organized. And I think that is the biggest tip that I can give students who are thinking about online degrees. If you are naturally a highly organized, a highly sort of routinized person, then that's great. It's going to work well for you. If you're not, know going in that you are going to have to develop a strategy for keeping track of everything. I am a very tactile person. I like to make lists. I like to check things off. And so I would make every semester a big grid of all of my courses, all of the assignments, when everything was due. And I would go through and I would print that out and I would go through with a highlighter each week. At the start of the week, figure out what was coming up. And then as I would do the things, I would cross through them with a highlighter. And for me, that was the strategy that helped me to stay on track of things, because I was also balancing working full time and having a life. And so that's really the thing that I think sneaks up on people about online courses. For those of us that are used to on-campus courses where, okay, you go in, you sit down and you listen and they tell you what to do and you say, okay, I'll do that. Okay. And, online courses aren't that way, particularly here at UAB in the School of Public Health, because our courses are also asynchronous, meaning you don't have to be there at a particular time. On occasion, there'll be, group assignments or that sort of thing where you do have to coordinate a time with other people. But for the most part, our courses are completely asynchronous. And so you have to pick a time that you're going to be able to go online, complete your assignments, view all your materials, all that sort of thing. So it really takes a level of discipline that I think surprises people when they first start. Because I won't be there looking to see. Secretly, I can't see. You can tell when people are on campus, but it doesn't feel like I can see. You won't notice me seeing, whether you've logged into courses or whatnot. So that level of accountability isn't there, and that can be a real challenge for people. So that's something that I always push people to think about when they're trying to decide between an online master's program and actually coming to campus. Are you going to have the level of commitment, the level of responsibility to make yourself do things when you don't have a professor standing over you saying, okay, gotta listen to my lecture now. So, yeah. That's exactly how I sound in class too. No, not really.
Thank you. And so my next question, we've just implemented this new core curriculum. Tell us a little bit about that, what that means for the program and just their experience and the skills learned during that.
Yeah, so in 2016, our accrediting body, the Council for Education on Public Health, released new competencies. So these are the things that they say all students with a degree in public health should be able to do. And those competencies that they released are very much focused on public health practice. What do people actually do? Not what do professors sit in their offices and do, no. But what do people who go out into the field of public health actually need to know how to do in order to be successful? And so when we saw these new criteria, we were like, oh, that's kind of not what we're teaching. We're teaching people how to, read research articles and that sort of thing. And while that's important, we really weren't focusing as much on the hands-on skills that students really need to have. So we did a complete overhaul of our core courses. These are the courses that students in any concentration, healthcare, organization and policy, health behavior, whatever concentration students are in, they all take the same core set of courses. And it used to be, a course in epidemiology, a course in biostatistics, and so on. But now we've created these new core courses that illustrate the ways that people actually do public health. So it uses the evidence-based public health model. That's a thing. Google it, pull it up. It's a circular model because it's this iterative process that we go through in public health where we look at the community and we say, what are the big issues in this community? Okay, how can we quantify those particular issues? What policies and programs might help to address those issues? were the policies and programs that we implemented effective? If not, okay, let's go back to our community and start over again. So you can see it's a cyclical process. And we designed our courses to reflect that same cyclical process. So the core courses now are offered sequentially in 7-week terms. So it starts out with a course on community assessment, and then a course on quantitative methods in public health, and then that course in policies and programs, and then management and evaluation. Then there's a capstone that brings all of those together and applies them to issues in environmental health, so that you can see what that cyclical process looks like to address a particular public health issue. And each of these courses is really intentionally designed to focus on the types of skills that students need in the workforce. So rather than doing a bunch of assignments where here's a workbook and answer all these questions and don't think about how that actually applies to anything in the real world. No, we've thrown out all of that traditional sort of approach to teaching. And now everything is focused around, okay, find a community health assessment and look at how they have collected the data for that. What are some of the, the strengths and weaknesses of that approach? And what would you do differently, if you were in public health practice, that sort of thing. So it's just a much more hands-on, real world way of teaching about public health. Yeah.
Thank you. And just one last question. What just advice, thoughts, feedback you want to give these students going into the information session and through the process?
Oh, wow. I think the most important thing is to really think about what are the things that you're already passionate about, whether it's particular topics or, even if it's sort of ways of working, types of skills. Often when people are asking me, where can I be in public health? What's my role? What kind of job should I have? I start to ask really fundamental questions, and people are often really surprised. I'm like, well, do you want to sit in an office or do you want to work out in the field? And they're like, what kind of question is that? Doesn't everyone sit in an office? Nope, not in public health. Lots of people work out in the field. And they're like, oh, well, I really don't like to sit down. Maybe I want to be a person who works out in the field. And, sort of taking it from there and thinking through, what do you want your day to look like? Do you prefer to work with data like me? Or do you prefer to work with people? Do you prefer to work one-on-one with people, or do you prefer to work with large groups of people? Thinking through those sorts of things and then matching that to the types of opportunities that are available in public health. I think that coming in with that perspective of, what am I already passionate about? What am I already good at? And really building on those strengths, because, public health is such a broad field. There's not just one public health career. When I'm advising students about finding public health jobs, they often say, well, I Googled public health job and nothing came up. And I say, yeah, that's true. It's a little more complex than that, finding a position in public health, because truly anything can be a public health job. And so I always tell people, well, what did you mean when you put in public health job? What sort of things were you hoping to come up? And really drilling down and thinking about all the different opportunities. I think that's the biggest thing that I would tell people, be mindful of the things that you're already good at, the things that you already care about, that you're passionate about, and be looking for ways. And, hint, I've built it into the curriculum. I've built it into some of the co-curricular stuff of helping students to say, okay, here's what I'm good at. And that's how these types of skills could be used in public health, and really take advantage of the work that we do to help you make those linkages so that you have a clear sense, what your career path could be when you finish your degree here with us.
So here are just a few accolades about UAB that some of you may know, but others may not. The first one that I would like to mention is that UAB is the third largest public hospital in the US. And that means that when you go and pursue your education, you're not just getting mentorship opportunities from faculty within the department, you're getting mentorship opportunities from world-renowned faculty from across the world and across campus. Additionally, UAB is consistently recognized as a diversity champion. And that means not only are we a diverse campus, but we celebrate our diversity. And one thing to note is that the School of Public Health is actually one of the more diverse schools across campus. So if you join us for your graduate education, you'll enter a program with some of the best and brightest from across the world. So here's just some information about the School of Public Health. We are the only CFA accredited institution in the state of Alabama, and we currently are ranked 17th in the entire country. I'm updating these slides. We've been 19th for quite a while, and we're currently 17th, so we're very happy about that. And actually, of the top 17 schools of public health, we are among the most affordable. So just keep that in mind when you're planning which institutions to choose. So what is public health? I kept this slide in there because I still get some questions. I know one thing about the past year is that it really has brought the importance of public health to light. But again, just because I get those questions, I'm just included this. So public health is all around us, and it's specifically the science and art of protecting communities. It's about prevention. And I always like to use the example of the doctors treat the patient in the clinics, while public health professionals work to prevent them from ever getting there in the first place. And on our programs, we teach you how to educate, promote, and conduct research on ways to improve the health and well-being of your community. And regardless of what area of public health that you choose to go into, whether you choose the practice, education, or promotion piece, we'll give you the tools to be successful in all areas of public health. And our job is to teach you to prevent health problems from happening before they occur. So here's just some common undergraduate majors. I always get the question of, well, I don't have a background in public health. Should I do this degree? You know, public health is so interdisciplinary. And one wonderful thing about our programs in particular is you have such a diverse group of students that you're working with, from a biology student to an international student to an out-of-state student, that you're just getting all of this knowledge that really enriches the class discussion. So don't worry if you don't have that background. Public health is interdisciplinary, and we love the diversity. So here are just the departments within the School of Public Health. Briefly, you're going to get the opportunity to speak with faculty in these departments. So I highly encourage you, even if you aren't, even if you know what program you're interested in, if you think you might be interested in another program, pop in, get to know that faculty member, talk with that program coordinator, just see all of the programs that we offer at the School of Public Health. But with a degree in biostatistics, you'll be trained in statistical data analysis. And once you graduate, you'll feel confident as a well-trained biostatistician to conduct research in all areas of public health. Environmental health sciences is where the study of health and the environment intersect. So with a degree in that department, you should be able to develop strategies for the prevention of occupational health and injury. And epidemiology is just the study of diseases, both chronic and infectious. A degree in this department will train you on how to study the patterns in a patient population so you can conduct research or develop intervention initiatives. And health behavior is the psychology of health. So a degree from this department will help you better understand the why behind health outcomes, specifically the social factors that impact health. And finally, healthcare organization and policy is the management and policy side of public health. So students with a degree from this department will be trained in policy analysis, healthcare organization, or you can choose to focus in maternal and child health policy and leadership if that's your area of interest. So this is just a short list of the companies that employ or have employed our graduates. As you can see, there's a mix of public and private institutions. To me, this slide represents how integral public health is to the fabric of our society. And it's just proof that a degree from the UAB School of Public Health will prepare you for the workforce and prepare you for every area of public health and beyond. So Dr. Austin touched on this briefly, just the difference between a practice versus research-based degree. It's very important to know that before you go into the application process, because they serve very unique purposes in the public health workforce. So an MPH or DRPH degree those are our practice-based degrees. So if you want to be boots on the ground working in the field of public health, pick one of these degrees. The MSPH, MS, or PhD are research-based degrees. So if you like to be behind the scenes, check out these programs, particularly the MSPH. Since the MPH is more popular, I would say that we find students who they think the MPH is for them, and then they say, oh, I actually really enjoy doing research. Well, let me check out that MSPH degree. So it's always great to do that before you start the application process. And this is just a brief note about our new core curriculum, but Dr. Austin already went over that earlier. We just train you in all areas of public health. It's based on the evidence-based model, or the evidence-based public health model, and it gives students the tools to become competent leaders in the field of public health. So where to apply? So this is one of the most important things to know before you submit your application. If you're applying to the traditional MPH, MSPH, or DRPH program, you'll submit your application through SOFIS. One thing to keep in mind is that all transcripts have to be verified, and they typically take about 3 to 4 weeks. So even if the application deadline is July 1st, for example, you're going to want to submit that application well in advance to give yourself time to complete that process fully. Once you're admitted, you will have to submit a supplemental application. We do require this because technically you aren't admitted into the graduate school until you submit your supplemental application to the graduate school. You're just submitting demographic information. Dustin Shaw, our admissions coordinator, sends all of your application documents to the graduate school, so they have that on the back end. You don't have to submit a whole new application, but just keep that in mind again as you're moving through the process. And if you're applying to an accelerated bachelor's to master's, fast track program, or coordinated degree program, master's of science or PhD program, you don't have to worry about the verification process because the graduate school just accepts those transcripts. And once you're admitted, we just ask that you let us know if you plan to enroll. So we don't have a deposit that you have to worry about. So these are just the admissions requirements for our master's degree program. We still waive the GRE for the MS and MSPH programs currently for the 2021 cycle. It will be up to the programs to continue that. So if you are interested in a program for the next cycle, maybe just ask the program coordinator in one of those sessions, because I know the departments are discussing that internally as we speak. I want to, again, just touch on the importance of the statement of purpose. It's so important to identify not only why you're interested in public health, but why public health at UAB. How can that degree help you reach your career goals? And here are the admissions requirements for the doctoral program. At the bottom, it's in bold because I think it's so important. So what applicants don't think about is they don't think about the importance of the mentor in the doctoral education. If there is not a mentor that both shares your research interests and has availability to take on you as a mentee, then even if you're an exceptional applicant, you may not be admitted. That's so important. And I want any of my doctoral applicants out there, please star exclamation point, put that on a piece of paper somewhere, because that's so important. And it's also a weight off of your shoulders, right? Because not only are you a good fit for our program, but are we a good fit for you in your career trajectory? So here's just some important deadlines to keep in mind. The ones coming up, so for biostatistics, May 1st is the deadline for all domestic applicants for all of their programs. May 15th is the doctoral deadline for the PhD in epidemiology program, and July 1st is the deadline for all other programs starting in the fall. And I also note for the scholarship deadline, if you think, oh gosh, I've just missed that scholarship deadline, just know that you can apply as a current student for the next cycle, and it will just go into effect the next academic year. So here are just some of our general coordinator degree programs. One thing I want to touch on, I don't want to touch on too much because Dustin, Sean, Dr. Austin will be discussing this in their presentation. But in terms of the admissions process, our professional programs, the PharmD, MPH, MD, MPH, MD, MSPH, you do not qualify for those until you're admitted into that professional degree program. Our program is not a gateway to those programs. I think some applicants get confused on that notion, but you have to be admitted to their program first. Now, the MBA, MPA, the MSW program, you don't have to, you could submit your applications concurrently, but we are in communication with our counterparts in those schools to make sure that you're moving through the process appropriately. And write these names down, write these numbers down and emails down. They're the most important people that you will meet during the application process. They're the next point once your application is complete. So they submit your documents to the review committee once Dustin and I do. And they're going to help guide you through the curriculum planning process and really all through your time here. So this is my contact information and Dustin Shaw's contact information. Write it down. Feel free to email me with any questions or concerns that you have. We're here to help and make this process as smooth as possible.